We've all experienced it, sitting in the waiting room at the doctor's office, waiting for what amounts to a 2-minute conversation with your doctor. But it's what's in that 2-minute conversation that may make the difference in a proper diagnosis. We're going to tell you about 7 things you need to talk about with your doctor. And our next guest, Dr. Jorge Rodriguez, an MD VIP physician out of California. Dr. Rodriguez, welcome.
Well, thank you.
So you're saying the doctor really needs to be a detective?
Absolutely. The doctor and first and foremost, the doctor and the patient have to have a relationship where the patient feels comfortable talking about a lot of personal things. And the take-home message should be that the patient has to remember that they're a patient, and their job is to describe what they're feeling, not come up with a diagnosis. And I think that will open up a lot of time and a lot of greater dialogue between doctor and patient.
Describe what you're feeling, and in a way, try to look at the doctor as if it's almost a therapist, because we're going to go through 7 things you need to go through.
Absolutely. We are
many
therapists.
of them are personal. You
Yes,
are therapists.
We are therapists.
First and foremost, you say, is talk about your hobbies. Why?
Well, because the hobby may give us indications as to why you're having these pains, why the ankle continues to hurt. Plus, it could give you some insight if this person has a well-rounded life. Are they depressed? Maybe they don't have any hobbies or any outlets and spend most of their time at home. So not only could it give us clues as to what may be physically going on, but also emotionally.
Emotionally, physically, financially. Why talk about finances?
Well, that one right now is almost like a no-brainer, because finances tie into mental health, tie into sometimes even whether the patient can afford their medications. A lot of elderly people in these difficult times are cutting back on their medications, sometimes cutting them in half. So that might explain why their blood pressure is high, why their cholesterol is not doing as well. So finances, and now finances, are creating a lot of depression. So all that ties in. Plus, it lets you know your doctor, and your doctor knows you.
Personal life and career.
Super important. The relationships that we have give us clues not only as to how we're doing mentally, but it also gives us a clue as to why the person is really there. In bad relationships, sometimes one of the partners comes in and they may be saying that they're nauseated, that they're losing weight, when the truth is they may be having a partner who's cheating on them and they're trying to look more attractive and they're just nervous. So knowing the dynamics of what's going on with a partner or at work is crucial to understanding the person.
Talking about that, talking about a subject that deals with that can be a bit embarrassing, but your sexual habits.
Yeah, sexual history is crucial. And everything from, someone's personal sexual choices, to what gender they prefer, to how often you're having sex, to whether you're having satisfying sex. I mean, for men, it could be talking about erectile dysfunction, is the problem. For women, are they entering menopause? Is it part of a bad relationship? So this is very embarrassing for people. But as you get to know your doctor, one of the joys is coming in and, you just tell them, hey, how's it going? You guys getting, relationships better? Yeah. It really is very crucial.
Kind of in keeping with that, sleep habits and how much sleep you're getting each night, that really plays a role in our daily health, doesn't it?
Absolutely. Everything from the fact that sleep deprivation can also lead to depression. Sleep deprivation can lead to obesity. We now know that there are proteins that may not rise to a normal level if you don't get enough sleep. So that is very critical. Fibromyalgia is probably due to lack of sleep.
In keeping with what you talked about before, which is the patient who self-diagnoses, which is a no-no, as we know. Also keeping with that, talk about any ailments you have, not just what you think is the reason you're in there, not just about the sore throat or the pain here or there, but talk about anything that might be ailing you.
Exactly. Usually, since a lot of doctors' offices and a lot of doctors have very little time nowadays to talk to their patients. I mean, I'm sort of in a nice position where, as an MD VIP doctor, one of the things that we stress is to have more time with the patient. But let's say you only have 10 minutes. It's important to be concise and precise. So there's a difference between saying, hey, doc, you know what, I have heartburn, give me that blue pill that I see on TV, than saying, you know what, I have a pressure in my chest every time I eat. Yeah, that could be heartburn, but that could also be a heart attack. So it's important for the patient to describe what's going on, not prescribe what they need.
Speaking of prescriptions, talk about them. Talk about any medications you're taking.
Absolutely, and talk about things that you don't think are medications. Over-the-counter herbal remedies, over-the-counter things as simple as antacids. Sometimes they interfere with medications and don't let them work. And remember, there are 2 over-the-counter medications we rarely talk about: alcohol and cigarettes.
Yeah.
And I consider them, you know, certain medications. So we need to talk about those things that are not prescribed.
Now, here's the big question. How do we fit all that into 2 minutes of our time with the illustrious doctor?
Hopefully you get more than 2 minutes.
Yeah.
But if you go in knowing what you want to talk about and coming to it from the perspective of a patient as opposed to a doctor, the doctor doesn't have to spend time unraveling what it is you want. And actually, as you get more experience with your doctor, the fact that you now have a rapport and he knows your family history, knows about your kids, about your partner, makes it a lot easier for the next time to go right to the meat of the problem.
Make the doctor also a part of your family.
Absolutely.
Dr. Rodriguez, thank you so much. If you'd like more information, check out our health page. You can find that at abcnews.com. Thanks for watching.